Have you asked yourself, what does your education want to look like in the next 5 to 10 years? My name is Matt Haberl. I'm from Specialized Physical Therapy Education. I just wanted to walk you through one of our upcoming new apprenticeship models to kind of bridge the gap between residency education and your continuing education. Continuing education has consistently been a topic of discussion within the profession of physical therapy. Most recently, an article was published called The Blind Man, the Elephant, and the Continuing Education course by Seth Peterson and colleagues. Here, it's kind of a common old tale of, if you haven't heard of The Blind Man and the Elephant, is, 6 blind men walk upon a structure, and the first one reaches its arms out and feels, "Oh, what is this? Oh, it's a nice circular trunk. It's sturdy and strong. It's a tree." But then the next looked at it. "No, it's skinny and slithery and wet. It's a snake." And so forth. The story continues forward as a spear, a rope, a wall, or even a fan. But in the end, it's really an elephant. And so when we look at kind of really the practice of physical therapy over time, based off of our different continuing education courses and experiences, we've seen that, we often come into each patient experience with a little bit different perspective. And so whether your con ed course was with the fascia being tight, whether it be a motor control problem, it's something down in the foot, or even more of a biomechanical fault, or, even most recently, the most common focus on it, it's all pain is in the brain, right? And so looking at, thinking about how education is going to move forward and how do we get away from some of these really silos of perspective and be more integrated into our practice. And so some of the recommendations has been to, really reform continuing education here in the state of Wisconsin. We actually submit all of our con ed courses through the CEU locker, where there's an external review process, which overall, like I said, is probably one of the most stringent models available at this time. There's been recommendations to either require some level of mentorship and early licensure, as well as required residency education. And coming from a residency education background, I think it's something that has been one of the most advantageous for my professional development, but also recognize some of the challenges and barriers that it may bring. And so when we look at kind of the traditional continuing education model, as we first graduate from PT school, we really start to just can't wait to start seeing patients on our own. Initial patients have a lot of good positive experiences, and then all of a sudden you start to get a little bit more challenging cases and start to realize this is actually a little bit harder than it looks like. I maybe go to one of my first con ed courses, I get really good with patient care interaction. All of a sudden I think I'm really doing well, but then again, more of those challenging cases start to come my way, and then it's like all of a sudden you feel like you don't get it anymore. The I don't knows start to outweigh the wins, and it really takes a lot of time for us to finally figure it out again. And what over time this has also been one of the driving factors, and 30% of PTs will actually experience burnout within the first 3 to 6 years of practice. But you know what? The one thing that prevents them from kind of that burnout is those personal accomplishments. Personal accomplishments are the biggest things in preventing burnout. And so when we look at residency education, this model was really built around how do we build the clinical reasoning in these individuals to really kind of pick the right information for that patient in front of them. How do we help mentor them to choose the best intervention? And then how do they become reflective long-term learners? And that's really the long-term goal of how we can, instead of get this learning curve of like climbing a rocky mountain, make it kind of be an accelerated curve straight up to where we then just have small ongoing reflection in our patient care as well as our clinical specialization. Now, the one thing that we have learned, I would say significantly from the post-pandemic time frame is the challenge of making this happen is residency education is a strong commitment. It takes a lot of time and effort, as well as just a lot of self-reflection in that growth. And when we look at the balance of, especially after 4 years of an entry level degree, followed by 3 years of a doctoral level degree, an additional year or even 2 years or 3 years to go into residency or fellowship education, really pushes some of these things of family, friends, and even your own self-help off to the side, when we're really providing a lot of time and effort into really our profession, which is our work as well. And so how can we do a better job of trying to meet this balance? And so we start to look at things backward. Let's look at things of residency education and kind of work backwards at it. Residency education, our model is 18 months long. There's strong weekly commitments, including kind of 4 different articles that you read a week, possibly a video to watch, an assignment to do, as well as some of the mentorship and skills work. And so it's a very vigorous curriculum. And so how can we look at this and work backwards? On one end of the spectrum, we have this heavily rigorous routine. On the other end of the spectrum, we have things like MedBridge, where you can just listen to certain videos and get continuing education. But how can we blend the two to really continue to kind of keep that excellence in kind of residency, or excuse me, excellence in our post-professional education? And so what we've done is we've actually taken that model of completing it at your own pace, where we provide on-demand videos, so you can still watch and rewatch the videos to kind of get that content information, and then it's performed in based off of video, and so it's all video format. You can listen, you can watch, but then the key here, I think, is the competency-based education component of it, where it's complemented with quizzes to make sure that you are learning that information. Just like any competency, you can also pre-check yourself out of it, right? So you don't have to watch the whole video if you already are competent in that information. So you can move forward without the additional time requirements that sometimes incurs. And so making that modification of how the curriculum is delivered, we still can implement some of the primary foundations to clinical reasoning, which builds really the communication process for between clinicians, help us kind of come together with different perspectives and biases, and then integrate that communication style into more of that patient care mentorship. And again, more times than not, almost every resident that graduates from residency programs say the best thing about residency education was the mentorship. It was the relationships. It was the ongoing partnership in helping you grow as an individual, but also kind of that communication with your patients and how you get some outside perspective in some of the things that you do. And then on top of it, throughout this process, we could with the on-demand content, we can still keep all the content knowledge that's required for sitting and passing your OCS exam, all based on the rigorous standards of our kind of post-professional residency education accreditation requirements. So big thing is again, there's a lot of work that goes into developing a residency program through the accreditation process. We now have kind of that background, but we also get now we can kind of back away from those standards and still deliver a very strong piece of content. So what this new model of specialization looks like on our end is we have our level 1, our clinical apprenticeship model. It's not a true residency based off of just how we deliver the content and some of the rigors that's still required with a residency, but it includes the on-demand courses, so all the course content. It includes the skills development as well as 48 hours of patient care mentorship. If that's too much for an individual, we have a level below that where it's just the on-demand courses as well as the mentorship, so it's really the thought process and the knowledge. And then below that, if you just want the information, we also just have the online content. All of this sits at with the foundation of clinical reasoning, and something we've been trying to bring to more organizations to get our clinicians to speak a common language, get us discussing our patients. And so that's something that our Foundations of Clinical Reasoning course does, which includes a little bit of virtual mentorship for us to learn to dialogue about our patients in a common language, but also looking at things from a common documentation side of things, communication, all those things that help improve that patient care experience. And so some point, we need to move away from this silo model of, providing biased patient care, right? So therapist biased care rather than patient-centered care. So let's get back to patient-centered care, bring our perspectives together, and move forward through some of this great clinical reasoning and mentorship. Finally, this is just a 30,000-foot view of what this looks like in terms of content. Each course has so many hours of on-demand content. The clinical reasoning course is 8 hours of on-demand. The spine is 15, and the lower and upper extremity are 10 hours. Each of them are complemented with an hour discussion, virtual discussion, as well as then any skills development if they choose to do the next level, as well as patient care mentorship. And so these are on demand, so you essentially, as you check the lists off of the course content, then you're eligible for the mentorship or the skills development to then really integrate all of your specialty skill sets into practice. So on deliver integration, we deliver this via Microsoft Teams and Streams, as well as then the virtual mentorship is also delivered via Microsoft Teams. Hands-on skills development is done either in person or virtually with an SPTE mentor, and then our one-to-one mentorship is still that in-person learner-led patient care. And here we have a kind of a standardized setup with it, where we still go through pre-mentor discussion, where the learner completes a pre-mentorship planning form. As we treat patients, there's a continued collaboration with that patient in terms of even dialogue to skills to practice, and then also at the end of the day, kind of a post-mentorship discussion with the mentor and the learner, kind of discussing things they can develop and work on. And so kind of that mentorship comes in a lot of different ways, but when it comes to patient care, having that consistent dialogue of what do I want to work on today, how did I do today, and what do I want to work on the next time. So kind of that constant reflection and action and moving forward. So if you're interested at all in getting involved with kind of SPT's apprenticeship program, hopefully if you made it to this point, you really are. And so I hope to hear from you. Feel free to email us at spteducation@gmail.com. Make sure to follow us on Instagram, Twitter, and Facebook. Thank you.